In this session, we will do two concepts. Now, in chapter 2 of our textbook, there are multiple concepts, and unfortunately for us, they are not interrelated. This means today I will be discussing iceberg phenomena, which is totally unconnected with control of disease. At this stage, because concepts we have to understand separately, and later on we will combine them. Naturally, when we will go to the applied SPM or community medicine, then these concepts will be applied, then they will be united. But at this stage, I cannot combine rehabilitation with, say, disease causation. So first we will do a very simple phenomenon, which is called iceberg phenomenon. Iceberg phenomenon means like the iceberg of Titanic. The most of the disease burden is hidden, and we see a very small portion of disease burden. Then we can give example. The iceberg phenomena I need not explain because there is nothing much you will not understand when you read. But however, we can improve upon what the book has said. Sometimes we can improve upon a subject or a topic by giving good examples and score what I say is 5 out of 5. Now, iceberg phenomena, you will make a diagram of iceberg, put a disease which is seen by the physician, and the disease which is hidden. Then we can give examples. The diseases which are hidden are communicable diseases like poliomyelitis, viral hepatitis. Non-communicable diseases like hypertension, diabetes is hidden. There is a phenomena of HAF also, which we know. Then nutritional diseases, anemia and PEM is hidden. Then genetic diseases, sickle cell trait is hidden. So this way we can give a good example. Then we can say why the diseases are hidden. Diseases are hidden because there is subclinical infection, because the infection is in incubation period, or a chronic disease in its latent period, or there is a latent infection, or there is a carrier state, or there is we are unable to, the patient does not report. Mental diseases are hidden because the patient does not seek treatment. So stigma plays a role. Then a patient comes to us, but we can't diagnose. I am a case of dengue, I come to you, but you treat me for fever and I become okay. So you have not diagnosed me as dengue because you don't have facilities for diagnosis. You are sitting in a remote area where the facilities were not there, and you treated me, I became all right, so I will be diagnosed as a fever case or viral infection, but I will not be diagnosed as a dengue. So the dengue iceberg still remains hidden. Then we can add what is the disadvantage of iceberg phenomena, what is the importance or significance of iceberg phenomena to public health. In communicable diseases, the hidden portion is spreading the infection. I am suffering from subclinical infection, but I am spreading the infection. I am a carrier state which is hidden, but I am passing on HIV to others. Similarly, in non-communicable diseases, if we detect late, then there is more harm. If the cervical cancer is detected at stage 4, naturally it is more harmful to the patient, to the community, to the health profession or health services, if as compared to it is detected early in carcinoma in C2 stage. And then lastly, we can add what we can do to detect this portion. How can we bring this portion about? It can be done by serosurveillance. It can be done by screening of diseases. It can be done by active surveillance. It can be done by education of patients. Like mental diseases, we can educate community so that the stigma is reduced, they come forward. So these points are very nicely compiled in my notes. So what I am trying to say is the iceberg phenomena is nicely given in book. It is very easily and nicely understood by students. Normally they do well, but there is a scope for further improvement. NEET is very fond of asking which disease do not show iceberg phenomena. The answer is measles, because measles does not has subclinical stages. All cases becomes clinical. Rabies also. Rabies, there is no subclinical case. All cases become clinical. So these are the diseases which do not show. The next thing which I should do it today only, that is the control of diseases. Control of diseases has got 4 stages. The first is disease control. The second is disease elimination. The third stage is disease disease elimination, eradication, and fourth is extinction of disease. So we will discuss given in textbook very nicely, but students need some clarification, and I will make it slightly simpler. Control means bringing the disease to a level that it does not remain a public health problem, which can be done by if I decrease the incidence, or I decrease the prevalence, or I decrease the death rate because of that infection or disease. I decrease the duration of disease. I make that disease less costly. I find it cheaper way of treating that. Earlier it was costing 100 rupees, now it is costing 5 rupees or 10 rupees. So that is also a level of control. So disease control means, basically remember the phrase, bringing the disease to a level that ceases to be a public health problem. The next stage is disease elimination. Disease elimination can be of 2 things. We eliminate the disease, or we eliminate the infection. Disease elimination means the disease will not be there, but the infection is there. The organism is there in my community, it is in my village. Let us take the example of tetanus. If we immunize everyone, 100% immunization which is successful, and everybody is immunized against tetanus, then the tetanus spores are sitting in the soil, but there is no disease. So we have eliminated the disease. The second is I eliminate the infection. Elimination of infection means that disease agent is not present in the defined geographical area. The best example is poliomyelitis, which has been eliminated from India. So there are no cases of polio in India, but we have to continue surveillance, and we have to continue control and preventive measures, which we are continuing by giving polio vaccine to children, polio vaccine in the national immunization schedule, and as well as pulse polio programs. Because the disease can be imported from where it is. It is still present. It is present in, say, Pakistan, or it is present in Afghanistan. So these cases can get into India. So we have to be active both for our surveillance and as well for our preventive and control measures. The third stage is eradication. Eradication means the disease agent is not present on this planet naturally. In natural circumstances, the disease agent is not there. When the disease agent is not there, then we need not take preventive and control measures. I have used the word naturally. This means the agent in eradication stage is still present in labs. Like smallpox disease has been eradicated, and its virus has been stored by USA and Russia in their secure labs for research purposes. So they feel that sometimes this virus will be needed so that to conduct researches. So they have stored it. And the fourth term which is there, disease extinction, is means the disease agent is not present naturally as well as in labs or artificial conditions. So I will again just repeat: disease control so that it ceases to remain a public health problem. Disease elimination, so it is not present in a defined geographical area. Disease eradication, the agent is not present on planet Earth naturally, but it may be present in the lab. And disease extinction, the agent is not present in nature as well as in lab. So at present, because smallpox virus is present in the labs, so it is still in eradication stage and it has not reached the stage of extinction. So we'll stop here because I have finished. We are almost touching 11 minutes. So we'll stop here and then we will continue further. Thank you.